Hey everybody, Dr. Ben here. Welcome. So excited to talk to you today about all this information coming out. World Health Organization, CDC, all these different people giving you different thought processes on should we have lockdown, should we be wearing masks, who's getting infected, all these different things. If you've been on Facebook at all, I'm sure you've seen a lot of chatter about these different things. So I thought I'd jump in, give you some ideas. I've read through a bunch of the research, read through the studies, read through anybody that's been getting this information out there, been trying to make sense of actually what is going on. So welcome. Let's get right to it. Dr. Ben here, Functional Medicine Center, Fort Collins, Colorado, Phoenix, Arizona. We work with people all over the country. So go ahead and as you're watching, drop in down below where you're watching from, just like Teresa just did, watching from Nebraska. Good to see you there. And then share this with anybody that you're like, holy cow, what are we supposed to be doing? Should we mask? Should we not? All these different things. So here we go. World Health Organization, what did they say? What happened? One of the lead directors of the World Health Organization came out a couple days ago and said that the lockdown is causing more harm than it's helping. And with this lockdown, we're talking about restricting travel, quarantines if somebody's coming in from different places, all of these different things. And so what this gentleman was saying was that in the beginning, sure, lockdown was probably appropriate. It was the right thing to do. As we were, some people didn't know what was going to happen. Some people didn't know it was going to be this huge thing, how bad it was going to be, all these different issues. And so they said, hey, you know what? If we are going to have this potential infection go through, this potential, worse than what we think it is, do we need to give the hospitals time? Do we need to give the hospitals, the medical professionals, get enough equipment, whatever we need? Do we need to give them time? Do you remember flattening the curve? Because they said, oh my gosh, if it goes up too high, people are going to be dying in the streets. All these different things. So they said, yes, we needed to do that. Get it under control, make sure people aren't dying in the streets, make sure that we are controlling the speed at which it's transmitting so that we can ultimately get ahead of it and not get overwhelmed in those systems. And which was done. There was no medical facilities, no cities around the world that were truly overrun, that people were dying in their cars, anything along those lines. Even in New York City, where the death rates were so much higher than most any place else, still was not that way. I have multiple nurses, people I know that went out there, were getting paid $30,000 a month to work, and actually got sent home early from some of the hospitals because they didn't have enough work to do there. So we accomplished that fact, but then what the World Health Organization just came out this week and said was this is actually doubling the number of people in poverty in the world, these lockdowns, especially in places like the Caribbean, tourist places around the world where Europeans or Asians or North Americans are going to go travel to these places like the Caribbean islands. No one's really been down there for a long time. Certain parts of Mexico, absolutely. So what's happened? Well, we've in essence, saved a few by sacrificing others. And so is that right? Is that wrong? I don't know. That's not what I'm here to tell you, but I'm just telling you what the World Health Organization said, and that the lockdown has actually caused more problems than it's been helpful for. It's also going to double the number of children in starvation level in this world, and that they're going to have a lot more deaths from starvation, from the poverty, from all these different things. So was it appropriate at the time? Maybe. It probably made sense to just take a step back, get a handle for where everything is. Now that we know this is not the Spanish flu, we know this isn't going to be 3, 4, 5% of the population. You know what? For those that are compromised, okay, that basically the World Health Organization, if you're compromised, you need to take a step back and you need to protect yourself and all that. But otherwise, the governments need to be opening up. They need to be letting people travel. They need to be letting people go and do what they want to do and vacation and all those things. Otherwise, the consequences around the world are going to be way worse than any virus or pandemic out there. So that's basically what the World Health Organization was saying. Then you may have been seeing the chatter on the CDC And the CDC had a survey that they sent out and surveyed certain people that had been infected, had not been infected with COVID. And you may have seen this little meme or little thing on Facebook or Instagram, some different places, saying that 71% of the people that got infected wore masks all the time. And so here's after breaking down some of the statistics in that survey. They found that 71% of the people for 14 days before getting infected, 71% of them were wearing masks almost entirely when they were outside of the house, shopping, anything like that, versus the people that in the control group that did not get infected, 74% of them were wearing masks all the time. So almost, not a statistical variance there. So almost, hey Lisa there out in Cape Cod, good to see you. It's 71%, 74%. You do survey another 1,000 people and it probably would flip-flop, or it's right around in that area. So almost statistically irrelevant, but both people that 14 days before getting infected, they were 71% of them were wearing masks all the time, versus the ones that were in the control group that did not have a COVID infection, 74% had been wearing a mask all the time as well. Hey Brian, good to see you. Come on back to Colorado. We'll see you soon. So 71%, 74%. The big thing that was different between the two groups was that 42% of the people that were in the positive group that had a positive COVID test, 42% had been around other people that were infected, versus only 14% of the people that were in the control group had been around people that were infected. So that is like the big variable there. Masks were not a variable. Masks did not determine whether somebody was infected or not infected, but the big variable was, were you around people that you knew were infected, and 42% versus 14%. And then you dig a little bit deeper, and they found that 51% of these people that were around 51% of the ones that were around infected people, 51% of them were around family that were infected. So very close contact. They're not wearing masks at home, so what are we supposed to do? Wear a mask at home now? Probably not realistic, probably not going to happen. So we had 71% versus 74% as far as they're wearing masks all the time. So pretty much over 70% of the people are wearing masks all the time. That's basically what we can look at this. And that the 71% were those that were infected. Although 42% of the people that were infected had been around someone else that they knew had an infection, had a positive test. And again, these are numbers going off of, was it an infection, was it a case, was it just a positive test? We don't know that. We know the stats there. So we don't know if it truly was an infection. Jennifer, clear as mud. Yeah. So let me know if you've got any more questions as we go through this. I'm trying to make it as simple as possible. So 42% had been in close contact with somebody else that was infected. Only 14% of the control group that was not infected, that did not have a positive test, only 14% had been around people that were infected. So 51% of those were family members, so that close contact definitely can be part of it. But the ones that were infected as well, they were 2 times as likely to have been at restaurants, bars, coffee shops, things like that, in the last 14 days. So, is there this potential for getting the spread, and if you're out and about and with family and touching people and all that? Absolutely. Just like any virus, any flu, anything like that. And if you hide away in your basement and never go out anywhere, never see the sun, very good chance that you may not get that infection. But that's not realistic. So again, we ultimately get back to, we've got to strengthen our body as much as possible, because we're going to get exposed. A lot of the information coming out lately is about aerosol, and that it's not the droplets that are the big concern with virus transmission, it's the aerosol. And aerosol can go through masks, and it's not going to block the aerosol transmission through there. So I always think about this, and I've been saying this for months now. So let's say, remember, for those of you that are old enough to remember the non-smoking and smoking sections. So for those that don't, the non-smoking used to be divided by this glass, and there'd be a gap around it, or you could go over. So smoke would still come around, it'd still go around the restaurant. It's just like they're not just breathing straight on you, and the smoke's not coming straight on you. But if you sit there long enough, you will smell smoke. You will smell like smoke eventually, and it's just going to be this continued process of disbursement of the smoke around the room. Same thing that happens in viruses. So for kids to sit in a classroom 8 hours a day, it really doesn't matter if there's 12 kids or 24 kids. Makes no difference, because 6 feet is irrelevant when you're in that type of a setting. And this is where there's some ridiculous, these songs out there where they're having the kids put their arms out and be 6 feet apart, has no relevance to whether someone gets transmission, or they get a positive test, or the virus gets exposed to someone. It's going to go around. If you've got vents and ductwork and all that, it can travel just like smoke could. And if somebody's smoking in the room next door, it could go up through that ductwork, and you could smell it just like that aerosol virus in there. So again, what do we do? Do we just social distance forever? Do we make people stand away? You can only have 12 kids in a room. You can't have more than 175 people in a gathering. You can only do so many people at a time. You have to wear a mask. Well, as far as the mask goes, a couple things that have been coming out lately as well, and we've been talking about wearing the mask correctly for a long time. But there was a report out of England that Jenny Harris, she's the Deputy Chief Medical Officer in the United Kingdom, and they were saying that masks must be worn correctly, so covering the full nose, full mask, not just a bandana, not even the little thin things that you're going to breathe through. All that must be worn correctly, changed frequently. We've been saying this for months. You've got to change your mask out 3, 4, 5 times a day, especially if it's cloth. You're going to hold on to fluid in there. That respiration has fluid in it, and you're going to get moist. You're going to get potential sinus infection, all these things. You must remove it properly. So anytime somebody touches the outside of the mask, they're actually supposed to wash their hands. How many times are you mask when you're wearing it? People are doing that all the time. And then you're supposed to dispose of it safely. So anytime you drop your mask to take a drink or eat or anything like that, you're supposed to wash your hands afterwards. And even when you take the mask off, if you take it off and put it down in your house and haven't disinfected it, washed it, anything like that, there's that potential for virus spread as well. So it's really interesting when we start talking about that. And I think again on the mask issue, it's not as clear cut as what some people make it out to be. Even in England, Jenny Harris, the Deputy Chief Medical Officer, she just came out and said that the viruses can actually get trapped inside the mask, and that any member of the public should not necessarily be just walking down the street wearing a mask, and they definitely shouldn't think that is going to protect them from anything. So it is not a cut and dry. It is not a 50-50, oh yeah, it's going to block 50% of it, anything like that. But what we do know, and we've talked about this before, vitamin D is going to be decreasing infection rate, decreasing fatality rate by at least 50%, if not more. And so we know there's even way better things out there and way more scientifically researched and proven than just wearing a mask, and yet that's what a lot of people are getting complacent in. We're not hearing, hey, social distance, mask, improve your immune system, get quality sleep, take X amount of vitamin D, all these things for getting your immune system and getting your body as vital as possible. Nobody's talking about that. Instead, we're like, hey, be safe. And it's like, you know what? We can only be so safe. And overall, and if you look at the lifespan of a virus, you are going to be much better off being strong than you are being safe. So, World Health Organization, CDC, a lot of new people coming out talking about masks and that they may not be as effective as they are. Should they not? What we do know is that there are going to be severe ramifications of lockdowns, and that World Health Organization is now saying, you know what, screw it, we got to open things up. We've missed that curve. We're not going to have this spike. We're not going to overrun hospitals, any of those things. So open it up. Be mindful if you're in that group of people that may get compromised, may get sick, but otherwise you've got to get out and get going. The CDC, they say it doesn't really matter whether you're wearing a mask or not. What's more of an issue is, hey, were you around somebody that was infected? Was a family member infected? Some of those things. Were you at a restaurant? Were you at a bar, coffee shop? So if you are older, if you have any of those pre-existing conditions, diabetes, cardiovascular disease, high blood pressure, if you're overweight or obese, any of those pre-existing conditions, you better be more careful, but you should be anyways, because you have a very good chance of getting the flu and dying from the flu as well. So you've got to be careful no matter what, and ultimately get your body healthy, get your body as vibrant as possible so that you can handle a flu or a cold or a COVID or no matter what comes at you. And then we also know that mask wearing has to be done correctly to really be effective, and even the material, most viruses, if they're aerosolized, are going to go through that material as well. So it's really more for people to feel safe and to feel like they're doing something and giving it that all to the community, and that it's our civic duty and all those things. That's more of what we're dealing with at this point. Very hard to look at a true double-blind study and say masks did not, masks did save somebody versus did not save somebody if they didn't wear one. So there you go. Share this with anybody that you know that is worried about this stuff, thinking about the WHO, thinking about CDC, any of these topics that are out there that you're seeing that are trending. You got to read through it, and don't take my word for it. Go look it up, look through what I'm saying. But this is what I'm seeing, and I try to interpret it for you guys and give you some constructive wisdom to go and live your life. But ultimately, get your vitamin D up, get your sleep, exercise appropriately, immune system, be strong, fight it off, and let your immune system take care of you. All right, guys, have a great day.